Well, good morning, everybody. We are going to be looking at white blood cells today. So, if I can get my screen to follow me. Okay, we're going to be looking at white blood cells today and the different types. Okay, so white blood cells. This one right here in the center is a white blood cell, and these ones are all the red blood cells. All right, once again, red blood cells and white blood cells. There are 1,000 red blood cells to one white blood cell, which is just, it's the ratio of our blood. Red blood cells are those oxygen carriers, carbon dioxide carriers, and the white blood cells are for our immunity. All right, so the first type of white blood cells we're going to talk about are the leukocytes. Leukocytes are less than 1% of the total blood volume, where we've got 5,000 to 10,000 in cubic millimeters. And any change in number or high or low number of leukocytes, these white blood cells, indicates that there is a disease involved. Okay, and ways that they get this number: when they take your blood, they do a small assay on a slide and literally do a white blood cell count. High white blood cell count would indicate that there's a large volume of them in comparison to the red blood cells, and low white blood cell count on the slide itself would show that there's only a few of them in comparison. Types of leukocytes or white blood cells include the following. They all contain a nucleus, unlike red blood cells. They can wander outside the circulatory system, which is called diapedesis. White blood cells White blood cells differ in the nature of their cytoplasm, their size, and the shape of the nucleus. They respond to different staining techniques, and they're divided into two groups by cytoplasm differences. There are the granulocytes and the agranulocytes. And these ones up here are the granulocytes, and these are the agranulocytes. Okay, the granulocytes. Their cytoplasm contains highly visible pebble-like objects known as the granules. As you can see with this one right here, it looks like there's like gravel inside there. They're twice the size of red blood cells. They contain a nucleus that is split into sections called lobes. That's where these granules come from. And they're produced in red marrow. The granulocytes include the neutrophils, eosinophils, and the basophils. The names come from the type of stain that brings out their distinguishing features. The neutrophils use a neutral stain, eosinophils, eosin stain, and basic stain for the basophils. That's how they were originally identified, and the name is stuck. Okay, so on with the neutrophils. The neutrophils are the most abundant of our leukocytes or granulocytes. They stain pink in a neutral stain. The nucleus contains 2 to 5 lobes inside of it. So a way to identify a neutrophil, there's going to be 2 to 5 of these granules inside there. That's that lobular nucleus. So right there's 3 of them. So that's a neutrophil. And these lobes are interconnected by thin bridges. See that bridge right there? You can see that one right there too. They make up about 60% of all the white blood cells in the normal blood sample. Some of the functions of a neutrophil, they can go through phagocytosis of foreign and dead cells. They use pinocytosis, and they have an antibody-dependent cellular cytotoxicity and rapid mobility in response to chemotactic migration. Okay, the eosinophils. They make up 1 to 4% of the white blood cells in a normal blood sample. The granules stain red in an acid stain that contains a dye known as eosin. The nucleus of an eosinophil typically has 2 lobes. Okay, so here's the eosinophil, granules inside here stained red, and those are the 2 lobes of the nucleus of the eosinophil. So remember 3 to 5 neutrophil, now 2 are the eosinophils. Eosinophils are not very mobile and they're not very active. They can go through phagocytosis of certain foreign particles produced by allergic reactions, okay, such as invading parasites, pollen grains, and mold spores. So if your sneezing allergies are affected, your eosinophils are activated. And here's a closer set of the eosinophils where we can see a little closer view of one. Okay, the basophils are the rarest of our leukocytes. They make up 0.5% or less of your white blood cells in your blood. Basophils have very large granules that stain blue in a basic stain. The nucleus is often bent into an S shape with 2 lobes. Okay, so you can see the larger granules in here of the basophils, and the nucleus is that S shape. All right, basophils in most cells produce a substance known as histamine, which causes swelling or inflammation. Swelling tells other white blood cells where to find the site of infection. Okay, so your basophils are responsible for those histamines. Okay, now for our agranulocytes. These are the cells that do not have those granules in them. Those include the monocyte, the lymphocyte, and the erythrocyte. But that's the red blood cell. So these 2 are the white blood cells. Agranulocytes contain a very small amount of those granules. That's why they're kind of called not granular. The 2 types, once again, are the monocytes and lymphocytes. Both are produced in red bone marrow. And they're also produced by organs of the lymphatic system, such as the lymph nodes, spleen, and thalamus. The monocyte is the largest cell that would be found in the blood. It's about 3 times larger than a normal red blood cell and 2 times larger than other granulocytes. The nucleus of the monocyte can be round, oval, or lobed, so it's just kind of has its own thing, but just know that it's really big. It often occupies most of the cell volume also. So the monocyte here, you can only see some of the cytoplasm. The rest of it is nucleus. Monocytes are going to make up 3 to 8% of the white blood cells in a blood sample. Okay, lymphocytes. Lymphocytes are the same size as a red blood cell. They're the smallest white blood cell that we have. It's round and has a large nucleus. See how, once again, the nucleus is taking up most of it. The way to differentiate between the lymphocyte and the monocyte then is to look at the size of the white blood cell compared to the red blood cells. Monocytes are going to be about 3 times as large. Lymphocytes are pretty close to the same size as a red blood cell. And 25 to 33% of the white blood cells in a blood sample are going to be lymphocytes. The function of the lymphocytes is to protect from disease and to move out of blood vessels.